Hello, bonjour, and welcome to today's webinar, Practicing Dentistry Before and After COVID-19. My name is Uthman Quick, and I'm the Marketing and Communications Lead here at Prep Doctors. I'm excited to have with me today Dr. Luciana Arcaro. Luciana is an infection control expert with an extensive background as a specialist in orthodontics and prosthodontics. I'd now like to hand over to Dr. Arcaro. So Luciana, over to you.
Thank you. Thank you for the wonderful introduction, and thank you for everyone to spend some time with us today. As you know, infection control has been a very hot topic right now in regards how it's going to be the new norm, what we need to be doing. So our goal today is really to get you ready for it and thinking of what could be the opportunities that you have to use this downtime. Also, on this understanding the transmission, the IPAC approach, so the infection prevention control. Also what you need to know. So what, by now you have heard a lot of information, have read it a lot. We want to making sure that we dissect some of the information and put some ease into everything that you're listening, and also a chance to ask questions. So what it is that is happening right now? What is the public health and the federal agencies' response and information load that we're getting? And what are they trying to accomplish with that? They're looking really to reduce mortality, right? We're looking into the word it is flatten the curve. So what that is control the disease. It's not gonna go away in 4 weeks as we are all hoping to it. What we're trying to do is minimize the transmission of the disease. Also protect our healthcare providers because they're working tremendous hours under a lot of pressure. So how are diseases in general transmitted, right? So between person to person. So now that's why we have been looking, and everyone is aware now of a social distancing, right? So that is your 6 feet apart. So if you were had an open bay operatory before, there was a social distancing also amount of space between your chairs. And that is the same kind of idea that is still applied to the human aspect of us. Think beyond, I know my IPAC personally, binder at the pandemic part was very small compared to I have 13 pages right now of procedures and protocols and how to do it. We were not ready for it, right? Like we had infection controls, they're great bases, they're things, but our screening process was not as strong as they should be. So risk assessment, I'm gonna talk a lot about that. So how we gonna approach infection control? Very 5-8 steps. And I think that really gives you idea in the goal that I want you to set up. Minimize, so how I gonna minimize cross-contamination and transmission risk? Points is a great start. But I also want you to think about, can I have aerosol? Can I use a rubber dam? If I have to use a rubber dam, do I have enough inventory? Do I have enough frames? Can I have a control to sterilize those instruments properly? We're gonna talk about the standards. So they are in Ontario specifically. We have a couple of standards. We have our RCDSO and we have our public health. Monitor and manage. So we're gonna look into how we're gonna monitor our patients from this point on. How we're gonna do a risk assessment and a triage. We needed to look into that aspect of it. What have we done in the past? Worked for us? How we're gonna manage our team gonna potentially be able to come back on a soft opening. If the schools are not opening, a lot of us are moms, right? Kids stay at home. Can my team still come back? We needed to think about those things. How many times we go to a course, we're all excited, we come back and the team goes, okay, don't worry, it's gonna go away, it's gonna go away. That, you know, that scanner that you got it, you're all excited, now it's a beautiful lab coat hanger. So don't do that with IPAC, it's not gonna go away. So I need you to making sure that you understand your reporting is important. You probably all are doing a lot of great things, but if you're not writing down when you do your environment cleaning, I don't know, as an inspector, as a person who's doing an audit. So there are around 20 different logs that you should have on your offices right now. So those are great, important 8 steps. And let's kind of define them a little bit further as we go. You're gonna need to know that we need to focus into routine practices. So what are gonna be, then it's gonna have droplets. What is gonna create aerosols? We're gonna dissect and be very granular, like, step by step, what a procedure looks like. What I'm gonna bring it into my operatory? What I'm gonna remove it out? Am I gonna have no more clutter around? I'm be able to wipe it on my surfaces, top to bottom. I'm gonna have to put barriers. What a type of barriers? So we're gonna be very granular, okay? Forget that you have been doing this for years and you're a superstar, you're efficient, you're great, you have a great practice. I'm not questioning that. We're all here because we all care about our profession, but we needed to go granularly to be able to understand the steps and also put ease on our patients and in our team members. Now, if you're close, we should have looked into how to close properly. Your office is a huge investment, and if it's not taken care and closed properly, just like when we close our cottages or we go away for a couple of weeks in the summertime, we unplug things, our offices are just the same. So there are great checklists out there that you can get it and download it, who really will give you step by step. So I know we panic and potentially we didn't look at those things. So I wanted just to remind you, it's not too late, please don't panic. But if you have not, there is tools out there and job aids that can help you to it. Once you close properly, every 2 to 3 days, I want you to go back in and have a look, right? And have the vacuum system run, have your compressor run for at least 15 minutes. Because when you come back, when we're ready to go back, we want to make sure that our practices are still in good shape. Touch base with your patients, let them know, have a conversation, a dialogue that we're excited to have them over. We're excited to let you know that we're ready, that we have to spend this downtime to get ourselves ready. And it's a safe environment for them to come. Their safety is as important for yourself than for themselves. So also we're gonna look into the future. So we're flattening the curve. We're not removing or curing COVID-19. So all those triages you're gonna be going through when we're gonna go back. What happens if my employee is sick? What am I gonna do, right? Do I have a plan? Do I have a backup? Do I have a floater? Because we learned that transmission happens very easily, right? And into our type of industry, we're one of the top 10 of exposure to and able to transmit. So we wanna make sure that we have that. The kit is disposable, right? The same single-use or disposable gowns. That is the key, single-use, disposable. So does your team and yourself know what it is a symbol of a disposable product? Okay, we have many in our offices, including burrs, including K files, including oxygen nozzles, including your sections. So going to the 2-hour window that Regina already have said and mentioned into it. In Ontario, we don't have that, but it's a good thing to know. I love this data. It is really how long living surfaces. So metal 5 days, wood 4, plastic 2 to 3, and stainless steel 2 to 3, cardboards 24 hours. So your Amazon packagings, okay, you spray them before you bring them home. And of course, paper, okay. That for me is the biggest one. What can we be doing right now? Are you a paperless type of practice? Can we be cashless, right? Money in papers usually have a lot of microorganisms there, viruses. It's the dirtiest thing in the world is money. So can I now take a debit? Do I have a limit on how much debit in a tap system I can have it? How can I minimize that transfer of paper? And understand what is better to use wipe, what is better to use sprays, and also the integrity of your surfaces, okay? So we cannot have porous materials into our practices anymore. And also if your chairs are ripped, you're required to fixing that because that compromises my ability to keep it disinfected, okay? Hand hygiene, no Bath and Body Works. I love those, you know, hand sanitizers and nice smelling good soaps, but they don't, a lot of times don't have the 70 to 90% alcohol that we require. Okay, so making sure they can be used at home, but into our offices is antimicrobial soaps, and it is a 70 to 90% alcohol-based hand sanitizers. We have been seeing a lot of videos out there. I love it. Has one of the nurses who talks about people using gloves in the grocery stores. And so understanding how donning and doffing your PPE and how the sequence is very important for us to protect ourselves as practices and individuals who work with patients day in, day out. So have posters like that. Public Health has a great graphic poster that you can place in every operatory. I want you to build your future into a calm manner, okay? So have a plan for 2 weeks from opening, 1 month, 3 months, 6 months, and 12 months. What are we gonna do as organization to continue to have? Every month you should be having your audit. So have an IPAC leader into your practice who will help you to continue being proactive in growing to the right direction. IPAC is a living, breathing. It's gonna change. So it's not gonna stop like we got that binder, it's done for the rest of our lives. No, they're changing. Life is changing. We are world traveling society right now. So we have to adapt.